Sustainable Development Initiative in Kenya Healthcare. Kenya faces significant healthcare challenges, including high material and child mortality rates, infectious disease. Why am I rapping? Such as HIV/AIDS, malaria, and tuberculosis. Inadequate healthcare. 3. Supporting global development initiatives in Kenya healthcare. Kenya faces significant healthcare challenges, including high material and child mortality rates, infectious diseases such as HIV/AIDS, malaria, and tuberculosis, inadequate healthcare infrastructure and resources, and limited access to quality healthcare services. Particularly in rural and underserved areas, a non-profit organization in Kenya is working to improve healthcare outcomes and access to healthcare services in rural communities through community health programs, mobile clinics, health education, and capacity building initiatives. However, the organization lacks efficient funding and technical expertise to scale up its interventions and reach more communities in need. Question 1. Explore the healthcare challenges faced by rural community in Kenya. So question 1, the answers. Healthcare challenges faced by rural communities in Kenya. Number 1 is high maternal and child mortality rates, that's giving birth and dying. Prevalence of infectious diseases, that's HIV/AIDS, malaria, and TB. Inadequate healthcare infrastructure, poorly equipped clinics, lack of available, lack of medicine. Shortage of trained healthcare personnel in rural areas, that's where those people are. And then limited access to healthcare due to geographical remoteness, or C is very far away. Then poor health education and awareness among rural population. Yeah, they're not educated on what those health are. Then inconsistent drug supply and lack of essential medical equipment. Yeah, that's self-explanatory. The next question is, devise a comprehensive development plan to address these challenges. So our comprehensive development plan, number 1 is infrastructure improvement, that's build and equip more rural health facilities, and also introduce solar powered mobile clinics for remote areas. Then number 2 is human resource development, that's where you train and deploy community health workers. Then incentivize medical professionals to serve in rural regions. Number 3 is health education programs. This is where we launch awareness campaigns on maternal care, nutrition, and sanitation, and even disease prevention. You can also introduce goals and community-based healthcare clubs. This one will educate them. And then number 4 is technology integration. This is where you implement telemedicine to connect rural patients with urban doctors, since most doctors are not in the rural areas. And then you can also use the SMS platform for health alerts and follow-up. Then number 5, we have supply chain management. This is where you improve logistics for medicine and medical supplies distribution. You can even partner with pharmaceutical firms to ensure affordable drugs. Then number 6, we have monitoring and evaluation. This is where you set up data collection systems to track health outcomes. Then you can also use local health committees to monitor service delivery. And then on the third question, and the last one, we have the identify potential partners to collaborate with in implementing the plan and supporting sustainable healthcare development in Kenya. So in potential partners for sustainable healthcare development, this is where the Ministry of Health comes in. Kenya for policy support and workforce development. The next one, we have the non-government organization. This is the NGOs, i.e. the MNF, Health Africa, or Red Cross. Then the next potential partner we can have is international organization. This is the WHO, the UNICEF, the USAID, the Global Fund. And then we can have another potential partner, which is faith-based organizations that often they run rural clinics. And then we can have the private health firms and pharmaceutical companies. We can use them for equipment and medicine supply. And then we can also look at the research institution, e.g. the Cambridge for public health and research and innovation. And then the last one is community-based organization, the CBOs, to ensure grassroots involvement. Thank you.
Okay, that's the end of our discussion. Say hi to your neighbor.